Your blood is constantly talking. It's sending out all these little secret messages that can tell doctors exactly what's going on inside your body. And in this explainer, we're going to learn how to eavesdrop. You know that feeling, right? You get a blood test report back, and it's just this confusing list of acronyms and numbers. Well, what if I told you that report is basically a case file, packed with clues? Today, we're going to put on our detective hats and learn how to read the evidence that's floating around in your blood. So here's our game plan. First, we'll figure out who these secret messengers are. Then, we'll get into what clues they're actually giving us and how to decode their signals. After that, we'll meet a few of the specialist informants before we put it all together to crack a real medical case. All right, first things first, we have to understand the basic premise of our investigation. How does the body even send out these distress signals in the first place? It's a really simple but powerful idea. Just imagine every single cell in your body is like a tiny, self-contained bag. When that bag gets damaged, whether from an injury or a disease, whatever's inside, well, it spills out into your bloodstream. And this, right here, is exactly what doctors are looking for. These leaked substances, especially these proteins called enzymes, they act like little biochemical flares or markers that signal damage. By measuring their levels, doctors can get a super precise snapshot of what's going on. It's like they're interrogating the body's own secret informants. Okay, so we know the clues are out there in the bloodstream. But what are these clues, really? Let's get to know our star piece of evidence, the plasma enzyme. So what's the deal with enzymes? Think of them as the tiny, tireless workforce that keeps your body running. They build things, they break things down, they make sure all the millions of chemical reactions you need to live are happening super efficiently. Now, this is the most important part to remember. The proper place for this workforce is inside the cellular factory. Sure, you might find one or two hanging around outside in the bloodstream, and that's totally normal. But if you suddenly see a huge crowd of them out there, that is a major red flag that the factory wall has been breached. So when that lab test comes back, doctors are on the hunt for anything that's out of the ordinary. An unusually high level? That almost always points to some kind of cell damage. But interestingly, a lower than normal level can also be a clue. It might suggest the body isn't making enough of a certain enzyme, maybe because of a genetic issue or something else. Now that we've identified our clues, we need to learn how to interpret them. You know, in any good investigation, it's not just about finding the evidence, it's about understanding what it means based on when you find it and how much of it you find. And in medicine, timing is absolutely everything. This brings us to something called the diagnostic window. It's basically the specific time frame when a particular clue is even visible. Some markers show up almost instantly, but then they fade away just as fast, while others take their time showing up, but stick around for days. A heart attack is a perfect example. Check this out. One enzyme, called CK, starts to rise within hours and is pretty much gone in a few days. But another one, LDH, is a late bloomer. It rises slowly and stays high for way longer. So by measuring both, doctors can figure out not just if a heart attack happened, but they can get a pretty good idea of when it happened too. The amount of the clue, the quantity, also tells a huge part of the story. A small increase in an enzyme might point to a more chronic, low-level problem. But a massive, marked increase, we're talking 10 times the normal level or even more, that suggests something really serious and acute is happening right now. Okay, so a high enzyme level points to cell damage. We've got that. But damage where? To answer that question, we need to call in the specialists. These are enzymes that are very specific to certain organs and tissues. Just look at this lineup of our key informants. If you see high levels of amylase, your investigation immediately zeroes in on the pancreas. Elevated ALT, well, that makes the liver your prime suspect. This tissue specificity is what allows doctors to turn a general suspicion into a targeted investigation. But there's a problem. Some of these informants are a little less specific. An enzyme like creatine kinase, or CK, is found in both the heart and in skeletal muscle. So how do you tell the difference? Well, you look for isoenzymes. Think of them as different models of the same worker, each wearing a slightly different uniform that's unique to their home factory. Using a really cool lab technique called electrophoresis, scientists can actually separate these different versions based on tiny physical differences, like their size or electrical charge. It is, for all intents and purposes, a biochemical police lineup.
By isolating the specific CK isoenzyme, a doctor can tell with confidence if the damage came from a pulled muscle or a life-threatening heart attack.
Okay, we have met our informants, we've learned their language. Now for the fun part. Let's see how this all comes together to help a doctor solve a real medical mystery.
So here's our case. A patient comes in, they're not feeling well, and all the symptoms seem to be pointing towards their liver. The first move for our detective, the doctor, is to order a blood test to start gathering some hard evidence.
The lab report comes back and wow, the evidence is dramatic. 2 of the key liver enzymes, AST and ALT, aren't just a little high, they are through the roof. We're talking more than 10 times the normal level. For any doctor, this is a 5-alarm fire.
So, what does this very specific pattern of evidence tell us? Well, according to our source material, a huge spike like this in both AST and ALT points strongly toward one of 2 major events, either a severe circulatory failure or, much more commonly, acute hepatitis, which can be caused by a virus or a toxin. And that's really the crucial point here. It's almost never just one single clue that solves the entire mystery. It's by looking at the whole pattern, which enzymes are up, by how much, and in what time frame, that doctors can build a powerful, compelling case, rule out other suspects, and land on the right diagnosis.
This whole field is just an incredible testament to how much we can learn just by listening to the quiet signals our body is sending